Next talk is by our young generation tech-savvy person, ophthalmologist among us, Dr. John Davies Akkara. He will be talking on integrating AI into your clinical practice and future directions.
So that was a very informative talk by Rajiv sir, and we should look at AI differently. Don't think that AI is going to take our jobs. Person who learns AI is going to take the job from the person who is not using AI. So that is what is important to learn. So AI definitions, I don't want to cover this. AI is everywhere in modern life. So ChatGPT and Siri and whatnot, and like evolution of man from monkeys. So this is AI becoming robots and all the autonomous cars. Everything is available. The search for AI, if you search in PubMed, there is a sudden increase in the number of searches and number of articles. Everything is going towards AI. In IJO, there are so many AI articles. Even in KJO, there are so many AI articles. These are some of the AI articles that I have written. And it's there in glaucoma, it's there in clinical diagnosis. It's seeing not only glaucoma and other eye diseases, it's looking at systemic diseases, oculomics. You can look at the retina photo and say this person might develop Alzheimer's or Parkinson's, or this is what this, this person will die in 5 years. That prediction can be made with fundus photo because it can look at cardiovascular risk. So all these things are already there. And why ophthalmology has a lot of AI? Because ophthalmology is full of images. Images starting from slit lamp, fundus, OCT, FFA, anterior segment OCT, everything, B-scan, topography, and lots of numerical data, IOP values, refraction values. Visual fields is not actually image, it is all values. Everything like this, it is called big data. Big data is what feeds AI. That is why ophthalmology is the branch for AI. And lots of things, can we trust AI? We'll find out. We'll have to keep a bit of salt for AI. Clinically, lot of diseases in ophthalmology, AI can diagnose and can also help to treat. It can help you to say what is the IOL power which you have to put for this patient with a very complicated eye. You can plan the squint surgeries. You can plan how many intravitreal injections a patient might need. This is a question which the patient will ask you. You told doctor that I will need intravitreal injections, maybe 1, maybe 5, how many, doctor? So you can answer that with the help of AI. It can predict. And as I said, oculomics, it can diagnose cognitive impairment, dementia, Alzheimer's, stroke. All these things are already there. They are published articles showing that you can detect some of these diseases from the fundus images and OCT pictures. And that is called oculomics, so we covered that already. And I have written an article in KJ about the same thing. And one other thing which all of us are familiar with are the large language models, ChatGPT, Claude, Gemini. All of these things, they are AIs which have been trained on lots of text data, and it can summarize research articles. It can even create a presentation for you. This part of the presentation is partly made by AI, so it can even help you study. It can read all the articles, make things for you. It can help you think of research ideas, think of what to do for your thesis, everything like that. Okay. And generative AI creates things such as new text, new images, videos, audio, even computer code. You want to make a program to find surgical induced astigmatism. You don't know what is programming. You just tell the AI, it will develop the software for you, and you can put your name on it and you can say so and so's SIA calculator. Very easy now. And that is the difference between discriminative AI and the generative AI. Discriminative AI is what looks at a fundus image and says this patient has grade 3 diabetic retinopathy or whatever. And the generative AI creates something. Okay. So another thing is notebook LM, which is very useful for learning. This problem with AI is it can make up hallucinations. It can give you content which is not real. Notebook LM, it is based, grounded on data which you give it. You can tell Notebook LM, okay, look at these 10, 20, up to 50 articles, including YouTube videos, and tell, okay, look at this content only and create a summary for me, create a summary so that I can learn about refractive surgery and artificial intelligence. So this is my process for learning about a new topic. You give the content, all the content which you are supposed to look through, you filter the content, and then Notebook LM will give you all sorts of things, including it can give you a podcast. It can generate an audio podcast between two AI speakers, and you can listen to it while you are driving, while you are in the gym. So it is making learning very efficient. AI in medical records, you saw Dr. Rajiv Sukumaran, he is talking about AI which will listen to your conversation with the patient. Patient comes and says, Kannu vedana undu. It will say, patient complains of pain. Etra naal. Everything is going to be converted into an EHR record, automatically translated between languages, and then it will ask you, we forgot to ask how many days he has this itching. So all those things, it will listen to you, fill up the data, it will tell you what is missing, it will guide you. So it's a guided, AI guided EMR. So that is right now in the works. It is almost here. This is another app. This is Uvioscope app, which is for uveitis patients, which myself and my wife, Dr. Anju, we have developed, in which you put the history of the patient, you put the details of the patient, it generates a summary, then you put the examination findings of the patient, it generates a summary, then using that, it gives you a list of diseases which could possibly lead to this particular set of symptoms and findings. So that is also there. And this particular thing is an AI which will take the history. So all these things are going to be time saving. So doctors who are going to be using AI efficiently are going to replace doctors who are not using AI. So will AI take your jobs? Yeah, like this it might. AI integration gap is there. So all of you are going to learn about all the things which are available. What are you going to do? What are you going to use in your practice when you go back Monday morning? So today there is a generative AI session happening in the conference. You can learn how to make AI generated PowerPoints and learn to do your own statistics with AI, so many other things that is going on. And you can learn some of these things yourself as well. And why now? Because there's a doctor-patient ratio in India is quite a thing. So you need to be more efficient to cater to more people. And patients are also very tech savvy. They want AI. They know AI. They have all access to the regular ChatGPT and Gemini. They are learning about various diseases before coming to you. You will get all those patients. Next few months, you're going to get patients who will tell you what to do. Okay. You have been getting that, but now they will tell you with evidence, because they are going to get evidence from ChatGPT. And cost effectiveness. AI is not expensive to use. Everything is now very cost effective because it's just software. So first you dip your toe, you wade in and then dive deep. We'll start with how you can get started. You can use AI to transcribe, and so that is what Dr. Rajiv Sukumaran said. So that is going to be the easiest to start with. You can use probably AI to make patient education materials. That is probably easier to start with. You just tell Gemini or ChatGPT, make a brochure for my hospital. It will do that. So that you can start very easily. Monday morning you can do that. Administrative automation also a little more difficult, you can do that. Then you go into a little more hardcore, you go into like clinical evaluation, diabetic retinopathy screening, glaucoma screening, etc. Going to be a little more difficult. OCT analysis is going on. OCT with more advanced AI can detect other systemic diseases. AI can improve the image quality from regular fundus cameras. So maybe you take a smartphone fundus photo, AI can enhance that image. That is also possible. Then when you go into deeper into AI, you can have multi-device AI. So all the OCTs, fields, fundus photo, everything together will be looked at by AI and will guide you on the treatment as well as anything you missed. It will tell you, okay, this is there, but maybe you should do another test to diagnose the case of uveitis or whatever. Then prediction. Patients can be told, this is your current visual fields. In the next 5 years, if your IOP is this much, this is what your visual field is going to be. You can generate that visual field, generate an image, and show them this is what is going to be. So you need a collaborative diagnosis. So future critical, you need clinical care, expertise, innovation. All these things are the directions in which it goes. So you will be able to predict the future. You will have video analysis AI, which will look at your surgical videos real time and tell you, wait, the hydrodissection was inadequate, please go back and do that. Or it will tell you, don't go close to. So all this is currently possible. There are AIs which can do that in research. It will come soon. Oculomics, all patients will be screened by ophthalmologists for systemic disorders. You will be sending the patient to the physician telling this patient has so and so disease, please take care, instead of the other way around. So that is what AI is going to do, and it will help in teaching, and so many things are going to be completely assisted by AI, even marketing and stuff. So these are the steps I want you to take. Go back and start with one step on Monday. Thank you.
Thank you, Dr. John. That was a wonderful exposition on the practice and a future